Hello, my name is Dr. Tracy, and I'm going to talk today about a rising concern in American society related to the increasing number of cases of inexplicable rage and the increasing number of PTSD and suicide cases in our military population and veterans. As a Chinese medicine practitioner, I'm going to discuss these in relation to some theories, particularly related to how we might interpret this in the clinic. So we'll look at the chart here, which is the 5 elements. And starting with the element fire, the organs related to that are the heart and small intestine, and the emotions related to that are joy and sadness. The earth element corresponds to the spleen and stomach organs, and the emotions such as overthinking, worry, and stress. The metal element is associated with the lung and large intestine organs, and the emotions grief and melancholy. The water element is associated with the kidneys and the bladder, and with the emotions fear, phobias, and anxiety. The wood element corresponds to the liver and the gallbladder, and is associated with such emotions as anger, rage, irritation, annoyance, and also frustration. Now you may be wondering whether, if you have any of these emotions, if that's abnormal. That's not the case. Just because the emotions are associated with a particular organ doesn't mean that's an indication of illness. A certain amount of all of these emotions is perfectly normal and healthy. The problem begins when any of these emotions become all-consuming, so that you aren't able to allow yourself to experience other emotions, that one totally dominates your life. And in the cases of inexplicable rage or PTSD and suicide, those emotions tend to be associated more with the wood and fire elements. So we'll talk a little bit more about those. In cases of rage, usually we don't experience that as the primary emotion. It's something that builds up over time. So if you think about a garden hose and you're watering the plants, and the water is flowing out, but then you begin to get a little agitated and your finger starts moving over the end and the water flows faster and harder, and maybe you're getting more frustrated about something, and so you clamp over more until that builds into anger, and eventually you close off the water completely, and that pressure builds behind until one day it erupts into a case of rage. That's what we're talking about. It explodes out, and it's at that point that a person may become harmful to themselves or to others. It's when that point is reached that the emotion of anger, as it transitions into rage, becomes unhealthy and potentially destructive. When we're talking about PTSD, that may manifest a number of different ways. One of the things that we will investigate in the clinic is the heart, and not necessarily a person's physical heart, but more the abstract function that the heart actually houses the mind in Chinese medicine. It's responsible for making sure you have good memory, concentration, the ability to process thoughts and emotions and act on them appropriately, to distinguish between what is real and what is not real. So that's a lot of responsibility for the heart, and to keep a very healthy mind. So in patients with PTSD, that ability to distinguish between real and non-real, to be able to think clearly, to be able to rationalize and have logical thought processes may have become disrupted. Ultimately, that may lead to the mind becoming dissociated from the body, that one cannot integrate what's happening in the mind with what's happening in the body. That may ultimately lead to deep sadness. It may also contribute to fear. Okay, that's a very important relationship there. And ultimately, again, that may become so intensified that the person may want to completely disassociate their mind from their body and not experience any more pain. And in that way, they may become harmful to themselves or others, and again, take that out in an act of violence. It's important to talk about this, as unpleasant as it may be, as we said, because this is happening more and more to the point where we're hearing about it in the news on a regular basis. If if you are experiencing mental health difficulties, if you are experiencing these emotions to the point where they have become all-consuming, seek help. The sooner you get help for mental or emotional imbalance, the more likely you have a chance of having a positive impact on your overall quality of life. If you or someone you know is experiencing crisis, if they have expressed suicidal intentions or homicidal intentions, get help immediately. If you would like more information on how Chinese medicine may play a role in your mental health care or your emotional well-being, please send us an email, info@doorwaytowellness.org, or give us a call at 512-937-3667. Thank you.